The federal government is making what for decades was a rare move.
That's right. The Department of Health and Human Services is decertifying an organ donation nonprofit based in both Cincinnati and Louisville. WLWT News 5's Todd Dykes is live outside Network for Hope's local office with those details. Hi, Todd.
Hi, Ashley and Chris. Yeah, HHS has a review of Network for Hope found that some patients showed signs that were not compatible with organ donation even after the process had started. But the nonprofit that's based locally in the building behind me, used to be known as Life Center before a merger. Well, it's an organization that's pushing back. Organ donation can offer a family hope when medical conditions seem dire. Network for Hope, which serves 7 million people in parts of 4 states, including Ohio, Indiana, and Kentucky, has explained to WLWT how donation can create a life-saving legacy.
We are approaching families on one of the worst days that they're going to experience, and to give them the ability or the hope that they can make the difference in lives of others through donation is impactful.
But now the U.S. Department of Health and Human Services is moving to decertify the organization. HHS says a years-long investigation identified more than 100 concerning cases, including 73 patients with neurological signs incompatible with organ donation.
Federal reviewers found serious deficiencies in nearly 30% of the cases that they examined. We found patients placed on the organ donation pathway who should have never been there.
HHS also points to the case of a Kentucky overdose patient who showed signs of waking up as a transplant team prepared to recover his organs. The man survived. That case led to a law that took effect 2 weeks ago in Kentucky called Pause and Procedure. It requires organ recovery efforts to stop if there are signs of life, unexpected neurological changes, or questions about a declaration of death. Network for Hope's CEO says the nonprofit helped develop that safeguard and is compliant with federal policies. HHS Secretary RFK Jr. claims otherwise.
We found repeated failures in clinical judgment, oversight, and patient safety.
Now, in a statement, Network for Hope's CEO Barry Massa says decertification will negatively affect more than 3,000 people who are waiting for transplants. I did reach out to the organization today to find out more about the situation and next steps, and I've yet to receive a response. If that changes, I'll be sure to let you know. For now, reporting live tonight, Todd Dykes, WLWT News 5.
Todd, does decertification mean Network for Hope has to stop operating immediately?
No, Ashley, and that's important to point out. HHS says it has initiated the decertification process, so there will be steps to follow. And the Network for Hope, though, they say they plan to file an appeal, so that'll take some time. And there is one partner organization that I reached out to today, UC Health. They said in a statement that it works with multiple organ recovery partners and does not expect a significant disruption to transplant services at this time. Ashley?
Todd Dykes leading the way for us tonight. Thanks so much, Todd.